All right. How we looking?
We are good.
All right. We're still missing two. We're still missing.
Side note, I'm trying to come down to Atlanta for 4th of July weekend.
Oh, okay. What part?
The Georgia area, Atlanta, Georgia.
Okay. What part?
I really don't know. I'm just coming down there with friends. They want to like the downtown area.
Downtown. Okay. Yeah. It's nice.
Yeah, I've heard. I mean, I've been there a few times.
Oh, okay. Yeah. I've been here 5 years now.
Oh,
Yeah.
not bad. What part?
I'm in Decatur.
Okay.
Yeah. Close to Stone Mountain.
Yeah. I had a friend who lived in Decatur area.
Yep. It's beautiful. All right. So we're missing one. I did say 2 minutes, right? All right, so I'm just gonna keep moving. All right, everybody okay so far? This is okay for everybody. All right,
Sure.
it's not too strenuous for you, right? I try to keep it as nice as and moving as possible. Okay, all right. So with strongest skills, now you need to know areas of development. Okay, what are your areas of development? What do you need work on, or what could you work on as an area of development for yourself? Okay, if math is not a strong suit of yours, then it would be math. Some of the positions that you're getting into, it may require you doing medical billing and coding. I'm sure there's a lot of math that you might have to do along with that position. So with the positions that you're thinking about, what do you think about yourself right now would be an area of development for you? Anybody? Then I'm going to start picking if nobody talks.
I'll probably say maybe my time management.
Yep.
Yeah, if I can like manage my time just a little bit better as far as like with my family, my social life, with the work life and stuff. I mean, I don't have really no work life right now, so that should be easy to manage. But like with the family and stuff, like when everything comes together, so time management might be one of the things I need to work on.
Okay, very good. Because we all have areas of development, all of us, as brilliant as we are. We all have something that we could do better or work on. So anybody else? Area of development.
Teamwork. I don't mind working with people, but I like to work more independently. So teamwork is definitely one of them I have to improve on a little bit.
Okay, so teamwork and collaboration for you. Yeah, okay, very good, very good. Let's just be honest. I mean, come on. Anybody else?
Yes,
Shanique.
me. I don't like maths.
Can I tell you a secret? Me either. Still, but I've had to learn how to do it. If you haven't
Yeah,
been,
I know it, but I just don't like it. It's like, too much. But for the dental assistants, maybe I'm not gonna need too many maths.
I beg to differ there.
Maybe I'm gonna need a lot.
I think so.
Yeah.
Yeah. You're gonna have to measure stuff. You're going to have to
Yeah.
mix
Oh, I'm gonna need
things.
like
You're
a lot
gonna.
of numbers and stuff. So that's what I'm gonna need to work on because my brain sometimes is all over. Especially with these kids, they drive me crazy.
Yeah, they bring home this new math. I remember when my kids were young, they used to bring home this new math that they're doing, and I used to just say, "Go to your mother with that," because I can't. I like you, my brain, I can't.
Yeah.
It's too much. It's overload. But
Yeah.
math is definitely something that you probably going to, you should work on. And I think with the workplace, they do have an organization that they work with that if people need extra help with their math, they send you extra ESL classes, things like that. They do send you to specific places. So I'm sure there is
Yeah.
definitely help for math.
Oh.
Very good. Anybody else? Just jump in. Areas of development. Area of development.
Maybe more patience. I probably could learn a little bit more patience.
Who's that? Oh, Cassie. Oh, okay.
Yeah. Having kids has definitely helped, but like something that I get frustrated with is like people that don't carry their own weight, like that you work with. I mean, that can be frustrating. So I think maybe being a little bit more patient and understanding.
Okay. Very good. Very good. Thanks for being honest. Anybody else?
I'm in the same boat with Cassandra. Like when I work with other people, when you're not carrying your weight, I get really frustrated. Yes. And I'll just be like, yo, I'll just do it myself. Just go sit down. Like.
And one thing though, people, it may look like they're not carrying their weight because a lot of people don't understand. Sometimes people need to understand what you need from them. And if you haven't explained it clearly or properly, then they'll be reluctant to, because they don't understand. And then the other side of that is people don't like asking for help. You know, you ever come across anybody like that sometimes? You don't like asking for help, you know, but I say there's nothing wrong with if you don't understand, okay, then yes, back up, excuse me, could you repeat that again? I didn't quite catch it. Don't be embarrassed to do that, especially if you're in a new position, because they expect you, if you don't get it, don't pretend like you have it. You know, don't be in that position. Don't be that person that pretend that you know it or pretend that you got it. And really, if you just ask a question, it would have saved you that whole trouble. All right. So try to think along those lines. I agree with you, but at the same time, there are people that don't understand what you need from them, especially if a person hasn't explained it properly. That's what I come to find that a lot. People just didn't get it. They don't understand it. So you got to break it down for them again.
Just to clarify, John, I'm talking to about those people that have been doing the same job for like 20 years.
Those people.
Yeah, it's some people that try and there's some people that are just lazy.
Yeah, you know what they're supposed to be doing.
True. I agree. I agree. Anybody else? Area of development. Who didn't say something yet? I know somebody didn't, trying to get away with it. Somebody.
I would say math skills and interpersonal skills.
Interpersonal. Okay. Now, with area of development, you've got to also think about how are you going to work on that. Okay. This is for everybody. With an area of development, like your math, how are you going to work on that? Okay. An employer may ask you, okay, what's your strength or weakness or an opportunity? You know, everybody has a weakness somewhere. Okay. So how are you going to work on that? All right. Interpersonal skills. Well, how am I going to work on that if it's that? Okay. So let's try to.
What skill would you say is like for, as far as like speech? Because I speak well, very well, but sometimes I might speak, I guess, more hood than, I might sound more hood than I should in a certain environment or a certain area.
Sound more hood than I should. Are you rhyming
more
there?
Hood than I should.
Yeah, code switch.
But like, what
you
would you call?
Then I would say try to think in professional terms, okay? We all are working on the professional side of us, okay?
No, I definitely keep it professional, but just sometimes like, like
practice. You've got to practice.
I might get emotional or something, or like something, and just say, just become more boisterous. And then when I become a little bit more boisterous, I just tend to lose the proper etiquette sometimes and stuff like that. So like, what would you call that? Like, what skills would you call pretty much like not to talk, in a certain manner?
Well, again,
say it again.
That's the word you're looking for, tactfulness. Like
tact.
Yeah. Don't worry, that's coming. Trust me, I'm coming there. You said that word. We're definitely going to look at that word. It's coming. But thank you, Cassie. But there are certain when you're in a professional environment, okay, I'm not saying you have to deny who you are, okay, but a professional environment requires professionalism, okay? And sometimes, you have to train your mind that way because a patient may be cursing at you and you can't. I know in your mind you want to retaliate back, but you have to be professional because they're looking at you as a professional. So I've had that done to me. I've had
I
that.
don't even mean like in a manner like that. I mean like.
No, I know
Okay,
what you're saying. Trust me. I got you, Ahmed. Trust me. I
no,
got you.
uh,
Uh-oh. I've lost somebody. Okay.
Because I can say very professional. Like my patience is like, you know what I mean, above and beyond stuff like that. I'll say like when
Hold on, I'm
I
hearing
say
a lot
certain
of
words.
noise somewhere.
I'm sorry.
Oh.
When I say certain words, they just sound more like my speech doesn't sound proper at times. Like when I say axe, is some, you know what I mean, some people might want to correct me, but like it's not axe, like you're chopping the ass, it's like you act, you know what I mean? So just like certain.
Yeah, I mean that's your culture, your dialect. I mean, you can't, unless you work on that, you can't necessarily change that. There's no, if you say axe, that's just how you say it. I mean, the proper way of saying it is ask, but at the same, you say axe. But
Yeah.
that's your dialect. That's how you talk. I mean, there's
it's just
you
our
can't deny that.
accents.
Yeah, it's just like a Jamaican
like
accent, right?
I have a Jamaican accent, but I know what I'm saying. I can't.
Only because I've been working in Greenwich. You know what I mean, working with white people. Sorry, you know what I mean, not to offend anybody. Working with white people, I would say like ass, and then they would want to correct me right there, and that would be like, excuse me, I'm a grown man. Like,
yeah, I work in Greenwich too.
You know what I mean? So like, don't do that to me. You know what I mean? Especially like in front of students or in front of kids. Like, pull me to the side and like, Mr. S, you said.
I mean, people. It just depends. I understand what you're saying.
I try to avoid that now, so I want to just fix my speech so I can avoid those little, you know what I mean, confrontations or little things like that.
All right, so let's deal with that. We're gonna move on. I'm gonna move on. We're gonna deal with that. Trust me, I got it in the PowerPoint. It's coming. And I'm glad that Cassandra kind of pointed that out. Tactful is definitely something. But before I get there, I want to ask you a question. Which qualities are important to you on the job or in your career? Okay. Give me your top. Can everybody see the board? Can you see the PowerPoint? Can everybody see that? Yes? Yes? Okay, so what are your top three important to you? What qualities are important to you at work? Okay. Can everybody see that?
Teamwork.
Okay.
And real honesty.
Uh-huh.
And it says workplace attire and behavior.
All right. Anybody else?
I would say integrity, cooperative attitude, and and positive work ethic.
Okay. Anybody else?
Definitely integrity, the ability to resolve workplace issues diplomatically, motivation for sure, and timeliness.
Okay. Very good. Let's keep it moving.
Friendly and helpful. I like definitely like a friendly, helpful environment. Just what she said, the ability to resolve workplace issues diplomatically, because I know certain people, like, they just don't know how to like resolve certain things, and teamwork.
Okay. Very good. Anybody else?
Sorry.
Integrity, teamwork, and a cooperative attitude.
All right. Very good.
I would say integrity, positive work ethic, and cooperative attitude.
Okay. Very good. Am I missing anybody? Who didn't go? Is that everybody?
No. Teamwork, being cooperative, and having a positive work ethic.
Okay. Very good. Because you got to know what's important to you, especially important on the job or in your career. Okay. You've got to know. So we're going to keep it moving. Okay. Let's look at career goals. Career goals. Oh, let's go back. All right. And of course, we all know, if you don't know, career goal is a result a person forecasts or plans and commits to achieve. And then a goal is the result of the achievement towards which effort is directed. Okay. Healthcare goals. Healthcare goals focus on team based care. I think somebody just said it about teamwork. Okay. It's a team effort. Okay. In order to get a patient better, to get them to where they need to be, it's not a one man effort. It's a team based. You need the phlebotomist, you need the nurse, you need the doctor, you need the transporter. Okay. From the EMT, you need everybody as a team trying to help this patient get better. So it's team based care. Okay. Which is the provision of health services to individuals, families, and communities led by at least two healthcare providers who work collaboratively. Okay, you may have the doctors and nurses working together. You may have the phlebotomist and the nurse working together. You may have the sterile processing and the surgeon, working together. Okay, but everybody works together in a team-based effort to get the patient better. Okay, to get them where they need to be. Okay, so when you do that, you accomplish shared goals. You both should have the same goal. Okay, and that goal is to work together to get the best possible result for the patient. Okay, that should be our mindset. That should be why we're coming into healthcare. Healthcare is not a solo project. Okay, healthcare is a team. It's everybody working together to help this patient get better. Okay, that should be the bottom line. All right. And so, positive attitude, to acquire healthcare goals, our mind must remain focused, okay, and professional to achieve success, a successful outcome, okay, for the patients, for the families, for whoever, okay, as we continue purposeful and sustainable healthcare, okay. Now, we all know stories of people that's been places and have gotten terrible healthcare, okay. We could name a few. There's a few homes, a few nursing facilities that have a bad reputation when it comes to healthcare. Everybody know that, right? There are a few around. Don't tell me. All right, I know a few. All right, but that should not be the object. The object is to make sure that when you get into healthcare, that you are working together with a team to kind of help the patient get better. That should be the focus. And the way we focus is with a positive attitude, okay? P is for positive, all right? Everybody unmute your phones for a second. Take your phones off of mute. Everybody say this with me. P is for positive.
P is for positive.
You don't sound like it. P is for positive.
P is for
positive.
All right. So you're thinking about good qualities of someone or something, that thinking that a good result will happen, okay? Somebody that's hopeful or optimistic, okay? So the P in positive attitude, it makes sure that you're thinking about the good qualities, or thinking, being hopeful and optimistic that a good result, okay? A dental assistant, okay? When that person comes in with their teeth, oh, cavity, oh, I need a root canal, okay? You should be thinking, okay, how can I help this person get the best possible result by applying the skills that I've learned to help that patient get better, okay? So the P is positive. Everybody say this with me. A is for accommodating.
A is for accommodating.
A is for accommodating.
Come on, y'all, work with me, work with me. Accommodating, all right? Somebody that's willing to do what someone else wants or requests, okay? I think Ahmed said it earlier, somebody that's helpful, okay? I think I've lost somebody. Who just left? Somebody left. Ronne, I think it was. Okay.
She probably had her appointment.
Yep, probably. She did say that, right? Yes, she did. All right. Keep moving. Accommodating. So someone that's willing and helpful. You ever been somewhere and you're asking for help and nobody really wants to help you? Anybody ever experienced that? Yep. you ask for help, and nobody really wants to help you, okay? But in healthcare, okay, the operative word for healthcare is care. And so you've got to care about people's requests, okay? You have to accommodate people, all right? Willing to do what someone else wants or requests, okay? Somebody that's helpful. Being helpful is an art. Everybody doesn't have that, okay? It's something that, you know, you see a need and you want to try to fulfill that need, okay? Regardless if you got to stay a little bit after hours, okay? That's somebody that's being helpful, assisting, okay? Making sure that I have what I need to make me comfortable, okay? So accommodating is the A. And then, I think we talked about this earlier, because Cassandra brought it up. Tactful. Everybody say tactful.
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 Wake up, y'all. Tactful, all right? All right, watch this. Has a keen sense of what to say or do to avoid giving offense. All right? You have a keen sense of what to say or what to do to avoid giving offense. Okay? You have skill in dealing with difficult or delicate situations. Careful not to offend or upset other people. Okay? Now, that is something that has to be learned. Okay? I say this to everybody, every class. You can't say everything that comes to your head. This is healthcare you're in. So you have to think about what you're saying before you actually say it. Okay? Because you can offend or upset a patient by thinking and saying everything that's in the top of your head. So when you come to work, you got to put on that professional hat. Okay? Make sure you take off that personal hat. Make sure you put on that professional hat, because patients and clients want to see a professional standing in front of them. All right, case in point, when you go to the hospital, isn't that something that you want to see? When you bring your kids to the hospital, don't you want them to see a professional? Hello, anybody?
Yeah.
Or is it just me?
No, you're right.
The person that's behind the desk, you know, you want to make sure that they are professional. They're speaking to you in a professional manner, or they're helping you. When you go to the doctor, when you go to the dentist, you're looking for professionals, okay? So it's the same way when you all get into the healthcare field, patients and clients are expecting the best possible person standing in front of them, okay? So tactful is definitely going to be a part, should be a part of your makeup, okay? You can't retaliate the same. Listen, I've been knocking some rooms to go to draw blood. I've had things thrown at me. I've had patients call me all kinds of names, okay? And listen, you got to put on your professional hat. You can't retaliate the same way they retaliate to you, okay? Because guess what? You need something from them. So no matter how much they fuss and fight, you still got to go in for the blood. They still need their blood work checked, right?
Yeah.
Yeah, of course.
Right.
You know, Miss Johnson still needs to be changed, no matter how much she's carrying on, and you know she's wet, so she needs to be changed. Okay. So you know we got to think about that. All right, we have to have a keen sense of what to say or do to avoid giving offense. Okay, even with your own coworkers. Okay, you got to be careful what you say. Right?
Yes.
Can I get one witness? Somebody? Anybody?
Yes.
Right? Even with coworkers, you know, you know, you're there to do a job, okay, as a team. Okay, so you have to be careful what we say to each other, even on the job. Okay, discreet, considerate, sensitive, understanding, thoughtful. Okay, you have delicate delicate situations that you will face. All right. So, saying that to say this, what is a positive attitude then? When you look at all of that, what do you think a positive attitude is?
Being upbeat, having a, positive outlook, looking for the good, not focusing on the negative, finding solutions, not bringing up problems.
love it. Very good. Being upbeat, not looking for the problems, but looking more for solution. Very good. Anybody else? Positive attitude.
Always putting your best foot forward. Always be, just like you said, like be attentive and willing to help other people and stuff like that.
Yep. Very good. Be willing and attentive to help other people. Very good. Anybody else? Positive attitude. What does that look like?
Going in with a smile on your face.
Smile. Something simple.
looking clean, looking like professional.
You know, smiling is one of the hardest things for some people to do.
I know.
It sounds simple, right? But I'm telling you, some people, if they smile, their face will just crack. It's the hardest thing to do sometimes. But just a simple, listen, if you're a patient and you're a client and you're in pain and you know, you want somebody that's bright, that's cheerful coming into your room to try to help you, okay? You don't want Nurse Ratchet to be coming in there.
Mm-hmm.
I'm just saying, you don't want, I'm telling Dr. No, you don't want those type of people to come into your room at that time. You want somebody that's going to be upbeat, that's going to try to help you, okay? Try to give you something for the pain, to try to help you, to try to turn you over, to try to get that, you know, be cheerful. There's nothing wrong with help. Good help is hard to find, as they say, okay? So that's good. Anybody else? Positive attitude. Come on, Kendra, and I can see the wheels turning. What you got?
Speaking positively at all times.
Speaking positively. Thank you. Speaking positively. Okay. Not being negative. You know, as much as you know the situation might be a negative situation. Okay, because there are some informations that we may get as healthcare workers that may be a negative, you know, situation. But even if you know that, okay, the object is not to disclose that, because we have to be professional and speak, you know, encouragingly, right? Not, oh, that's it. That's it. That's, you know, your time is up. You know, we've got to speak positively, speak positivity. Very good. Anybody else? Positive attitude. Lakeisha, is that you?
I would say on your face, no matter what happens.
What was that?
Yes. Keeping a smile on your face, no matter what happens, and finding the best in every situation and being empathetic.
Very good. I like the last one, being empathetic, okay? Being able to understand what the patient is going through and think rationally, okay? That is part of being expressing empathy, showing that you understand, okay? Coming to them on their level, understanding what they're dealing with, and then being able to assist them. It may be a tissue, it may be something in some water, it may be something else, okay? That's signs of empathy. Very good. All right, so we all kind of know what a positive attitude is, so let's flip that around. What's a negative attitude? This should be easy.
Coming in with an attitude, a nasty look on your face.
All of that.
Being condescending.
Yes.
Making the patient or the person, like belittling them, making them feel like they're like much smaller than you and stuff, or not as smart as you, or not smart in general.
Yeah. Very good. Very good. Anybody else? Negative attitude.
Not actively listening, you know, to the patient's concerns, you know, just brushing them off.
Actually, that's a skill. Again, actively listening. Okay, not just listening, because this is how what we do. Okay, we listen, and then in our mind we're formulating an answer, what we're going to say back to the person, instead of listening to them and being able to repeat back what they said.
Right.
That's what we do a lot of times. That's why patients would say, that's not what I said. This is what I said. That means you were not actively listening to them, because you were in your mind formulating an answer instead of listening to them thoroughly. Okay. Don't we do that all the time? Let's
Yeah.
be honest.
Yes.
Okay. We do that most of the time, but that's not active listening. Active listening is listening to what the patient or client or whoever is saying without interrupting them, without cutting them off, let them finish. Okay. Or being able to repeat back what they said. That's active listening. Okay. Not partial listening. Not cutting them off when you're ready.
Not just hearing.
Huh?
Not just hearing.
Not just hearing.
Hearing and listening. You know, I tell my kids that all the time. You heard me, but you didn't listen to me.
That's my mother used to always say that to me.
It's true. Because you can't repeat back what she said. I bet you could.
Nah.
Nah.
Only I knew if there was a slap coming after that, then I can repeat
That's
it.
it. They slap you. Yeah. Oh, yeah, I heard that. I get it. All right. Anybody else? Negative attitude. Negative.
Just being like, I guess what they call like a Debbie Downer. Just like you're down on everything. You're just mad about life, even though it's a beautiful day outside. You're mad that it's too blue, or it's too bright, or it's too hot, or it's too like you're just down on everything.
Like you walk into a room, good morning, and somebody, what's good about it?
Yeah.
Yeah, it's like a dull moment.
Like, come on, man. What are you? You're alive, maybe? You know what I mean?
Exactly. I'm still here.
You want me to give you a reason? All right. So very good. So now we know what a positive and a negative attitude is, right? A negative attitude, some people stay at the bottom and say, listen, it'll never happen. Okay. But the point is, you get up and you do something. Okay. A lot of you probably didn't hear about the workplace before. Okay. And a lot of your situations probably was you facing a negative attitude, unemployed and underemployed, but somehow, some way you found out about the workplace. Okay. So you're moving along the process from it'll never happen to realistically, it could happen. Okay. Now that you found this program, now that you're going to walk out this process, realistically, you can become the phlebotomist, you know. Realistically, you can become the dental assistant because you've moved from it'll never happen to realistically, it could happen. If you stick with this process now, guess what? A couple weeks, a couple months, it will happen. But the point is following the process, okay? A lot of people don't like to follow the process. And I say this to classes all the time. If your workforce specialist or your career counselor tells you to bring in something extra, go get this piece of information, I need to get this, you know, that's part of your process. Okay, so a lot of people get ticked off. Oh my God, hey, I can't, you know, trust me, I've heard it all. In 8 years, I've heard a lot. So whatever they ask you to get, whatever information they require from you, please, you know, just do it. Sometimes you have to call them. Sometimes you have to email them, because I hear people say again, oh, I've sent out emails, they don't respond. I've sent, you know, keep doing it. You know, you got to be persistent because you're not the only one in this process. Okay, guess how much hundreds of people that's in this process right now. Some are beginning, some are in the middle, some are ending. Okay, so they have a lot of people in this process, but the point is to keep moving throughout this process. That is the point. All right, everybody get that? Yep, you get that? All right. All right, so in negativity in the workplace, it increases patient and client complaints. Okay, so if there's negativity in the workplace, people are going to complain. Okay, absentees and tardiness. Okay, absentees, everybody see that? And tardiness. All right. Personality conflicts. You ever hear people say, I can't, oh my God, is she working today? Oh my God, I can't wait for this person to leave. Everybody have you ever heard that in the workplace?
Yes.
Is she working tonight? Oh my God.
Yes.
We've heard it all, right? Yeah.
Yes.
Yeah. Personality conflicts. Oh my God. do I have to go in tonight? Oh Lord, is that person? Oh, is she? Oh no. You know, we've all had those personality conflicts. Okay. Then you have loss of job morale. Okay, it sucks to work here. There's no incentives, right? There's no lack of motivation. You know, when the clock starts 7 o'clock, oh my God, I gotta get up to go to that place again.
Yep.
Anybody ever felt like that? Anybody?
Yep.
Yeah, we're
Yes.
talking about
Yes.
real life situations here, right? Come
It
on,
is. Yes.
right? It's life, right?
Yes.
And then some jobs have no creativity. They don't, you know, it's just one stop shop. That's it.
Mm-hmm.
There's no room for growth. There's no room to move up. There's no nothing. Okay, that can be negativity. Then there's no team spirit. Nobody wants to work together. No teamwork, as Kendra said. Okay, then you don't feel loyal to the organization. You know, whatever. You know, I'm just going whatever. You know, if you see me, you see me. If you don't see me, you don't see me. That's not a good attitude to have. All right. And so negativity, some statistics. All right. The Bureau of Labor and Statistics reports that $3 billion in productivity is lost every year due to workplace negativity. Okay. That's a lot of money, isn't it? So
Mm-hmm.
this is those people that go to work and start shopping online. Anybody like, you know anybody like that? This is those people that log on, punch themselves in, but yet go on an hour break. You know, we're talking about those types of things. You know, take the company car on the weekends and you go wherever you want to go. It's talking about those types of people, okay? When you're supposed to be at work, you're doing something else. That's why so much money is lost every year in productivity because of those types of things, okay? So my question is, how do you see the glass? How do you see the glass, people?
Half full.
Half full.
Sure?
You see it half full. I see it half full.
You see it half full? Is that the consensus for everybody?
Yes.
You sure about that?
Yeah, I'm thirsty now too, so yeah.
Because, all right, so let's look at the glass as an opportunity, right? What are some of the things that you could do with this glass, or let's just say a glass? What can you do with a glass? This ain't a glass, but
Break it.
okay. You can
Fill
break
it
it.
up.
You can fill it up with what?
Water or juice.
Water, juice, some Kool-Aid. What else?
You can
Milk.
empty it.
You could empty it. Yeah. What else?
Could put milk.
You could put some milk in there. Huh?
You could drink it and be satisfied.
You could drink it and be satisfied. That's right.
You can overflow it.
You can overflow it. Very
You could
good.
pour it in somebody else's cup.
Come on. Now you're thinking. I love it. You could pour it into somebody else's cup because you've taken advantage of your opportunity, right? And guess what we do with opportunities sometimes? Anybody ever done this with an opportunity?
Yeah, my kids do it every day. Half drunk waters.
A lot of the times we've wasted an opportunity. Anybody ever wasted an opportunity? Said to yourself, man, if I just had done that, if I just did that, then I'd be better off. Anybody ever said that?
Sure.
Yeah.
Or you say, I'll never do that again. Anybody ever said that?
Yeah, many times.
Many times,
Yeah.
right? Come on, let's just be real. And so this is what I say, all right? You have a glass, okay? You got a glass, what are you going to do with it? So you got to transfer from seeing your glass half empty or half full to the fact that you have a glass. Some people never get a glass. Some people never get an opportunity. You all have an opportunity to make something of this opportunity with the workplace. Okay, don't you know there's a lot of people right now would love to be where you guys are right now with this opportunity, right? Okay, so you gotta think to yourself, what can you do with the opportunities in your path? What are you going to make of this time with the workplace? Are you going to take full advantage of everything the workplace has to offer? Okay. And then with some opportunities, you got to think, well, what can I do differently this time? If it didn't work the first time, now you have another opportunity. What are you going to make work this time? What are you going to do differently to make something work properly this time? Okay. So see the glass as an opportunity. Okay. And be thankful that we have this opportunity and you have a glass. Because like I said, some people never get this opportunity. All right. That's how I see it. Okay. So, because attitude is what?
Everything.
Y'all reading this? Y'all? Attitude is?
Everything.
All right. So let's talk. We're talking some more. Listen, we're doing good. All right. I'm kind of rushing through this. Personal strengths. To develop a positive attitude, start to believe in yourself. Okay. To get a sense of who you are professionally, you got to first understand your own personal strengths. Okay. Asked this question at the beginning. Okay. Name a few of your own personal strengths that you could use in the workplace.
Patience.
We got patience again. Okay.
Yeah. Definitely patience working in a certain environments and stuff like that.
Yep.
Positive attitude.
Yep.
Don't
steal all of mine.
Time recognition, because you have to cover for other people, or some people's shifts are different, so you don't want to be super late when somebody else is like coming, you know what I mean, before you or after you, because just in case they have to leave, you don't know their situation.
Mm-hmm. Very good.
Organization skills.
Okay. Don't say them all. Leave some for others. Anybody else? Strengths. What can you bring? What do you have? I'm gonna start.
Ideas of improvement.
What was that?
Ideas of improvement.
Say the first word again. I didn't hear the first.
Ideas.
Ideas of improvement. Yeah. Okay, I'll take that. Anybody else?
Enthusiasm.
Yes, we all need some of that right now. Enthusiasm.
Confidence.
Confidence. Yes.
Positive attitude.
Don't steal mine.
Empathy.
Empathy, I heard. Yep. Come on, everybody, just chime in, jump in. Determination. Yes.
Flexibility.
Flexibility. Yes.
Self-motivation.
Self-motivation. I hope y'all writing this stuff down, because I'm going to ask you again later on, or maybe tomorrow. All right. Anything else before we're done?
Integrity.
Integrity. Yes. Very good. Oh, y'all disappeared now? We're going to get that pen and paper. I see it. All right. Very good. Okay. So we're going to keep moving. So we need all of that. All right. So I'm going to ask you a question. Let's do some self-affirmations. Here we are. People have complimented me on my ability to do what? Cassandra, I'm going to ask you. Start with you.
I don't know. I feel like I could talk to anybody. Like I'm really good at, I don't know, meeting people for the first time. I'm not afraid to talk to anybody.
Okay, very good. One thing people don't know about me is what? Ahmed. Did you leave? I can't hear you.
I said that I own snakes. I have 3 snakes, but that's, yes, boa constrictors. That's one thing not too many people know about me if they don't know me personally, stuff like that. But
You could keep those.
Oh,
That's fine. That's fine. We did not know that. All right. I feel good about myself when I do what? Kendra.
I feel good about myself when I accomplish a goal.
Yes, accomplishing a goal. All right. I'm proud of my ability to do what? Shantae.
Be on time. If I have to be on time. If I'm going to be late doing something, I don't want to do it at all.
All right. Very good. Something nice I recently did for someone else was what? Shanique. Did we lose you? Shanique?
Oh, my phone was muted. I offered him a ride.
You offer somebody a ride?
Yes.
Okay, very good. That's nice. This year, I decided to do what, Lakeisha?
This year, I decided to write and finish several books.
Oh, wow. What genre do you write, by the way?
Christian fiction and poetry.
Very good. If I didn't believe in me, I would be what, Cassandra?
a poor role model for my children.
Very good. Very good. One more. Negative situations push me to do what? Who wants to answer that one?
Do better.
Better.
Negative situations pushes me to do better.
Better.
Yep, I like that. Very good. All right. Keep it moving. Very good. We're cruising through this thing. So you appreciating you and being thankful, okay? That's one of the things that I tell people all the time. You're thankful for this opportunity, thankful for the workplace. You should be proud to be here, okay? Because now you have a support system and you're putting the support system in place, okay? So make sure you finish the week out, okay? You're not actually in the program until you actually finish the week, okay? So make sure you do what you have to do to get through the week so that you can be proud of saying, yes, now I'm in, I completed something, I can work towards or move towards my career path.
I thought it was 2 weeks.
Yeah, it may stretch over the span of 2 weeks based on
it's 7 days.
Yeah, I'm sorry about that. Yeah, they will stretch it, yeah. But with me, you're just with me for these 2 days.
Okay.
Lucky you.
I like that quote. Gratitude is the best attitude.
It is.
I've never seen that before.
Right? Being thankful, okay? It's the best attitude, okay? It's the best attitude. When you think about what you know, where you are right now, you know, that's the best attitude is gratitude, okay? So watch out for some challenges. Challenges are going to come along your way, okay? Things are going to come to you know, test you. Since you're now starting, some of you may be starting school soon, or you know, the online things. Okay, thank you for that. Challenges. When is it most challenging for you to have a positive attitude or keep a positive attitude? When what? When what? When is it challenging for you?
When you're in a negative environment and everybody's being negative. I mean, you want to be the positive voice, but sometimes it's difficult, you know, when you just can't turn people around. It could be a little discouraging.
It could be challenging, right?
Very challenging.
Very challenging. Okay, that's good.
Like,
yep, go ahead.
Earlier, that you're actually working and you look up and you see other people just sitting around doing nothing, just like relax. Even if it's something like it might not be their job per se, but they work with you and they just watch you drag something heavy and don't even get up to like help you or anything like that. Like, that's challenging.
Yeah. Yep. True statements. Very good. Anybody else? When is it challenging for you to keep a positive attitude? When what?
When I'm sitting in traffic.
Okay. This is more. Yeah. Okay. Anybody else? When what? When what's going on? Especially at work. In terms of work.
Like
A
a
lot of
lot of
chaos,
drama.
confusion.
I'm sorry, what was that?
A lot of drama, like in the workplace.
What would you say? Give me an example of drama.
Like usually when you work with a lot of women, like attitudes or jealousy.
No, you didn't.
Like, petty
No,
things
that's
like
where I'm at.
that.
I don't even feel like going back to work because I can't deal with it. It's like I'm doing other people's jobs and stressing me out more.
So that's what we class as drama. Lakeisha? Yeah?
Yeah.
Okay. When you're doing other people's work, Shanique, and what?
Like they just sitting there and not helping you.
Sitting
And they
around
getting
just watching you.
and basically they getting paid for their stuff and they're not doing it.
Yep, that can be challenging. Okay. Because we got to recognize the challenges, okay, before we put a solution to them, okay? You got to recognize what they are and understand what they are, and then try to focus on keeping positive and not let that or that situation pull you in or you become an accomplice to it. And then you end up losing your job and they keep theirs. All right, I've seen that scenario too. Where you are on the sidelines, but because they pulled you in and then you get in trouble and they don't. Okay, so you got to try to, even in that, maintain a positive attitude. Okay, positive attitude. What do we do when some of these challenges happen? What do you do? Okay, what do you do? That's another question.
Walk away and take a breath.
What was that?
Walk away and take a breath, like a deep breath.
Walk away, count to 10.
I'll just go like, "Hussa."
Okay, does that work?
Yes.
It does?
Not
Okay.
really.
It doesn't work really. Depends on the severity of the situation,
It
right?
depends.
Yeah.
Talk in the presence of a supervisor, so like try to hatch things out, but make sure somebody in manual position is there, so it's not a he say, she said, she said thing.
Yeah. Yeah. There are situations that require a higher level of intervention. Okay. A higher level of intervention, meaning a supervisor, a director, somebody that's, above. So you never take your situation down. You always take it up. Okay. So the people that's above you can give you the direction. I've been in circumstances, thank you, Ahmed, where I've had to do that with a coworker. Not getting along, pointing out faults, and just angry all the time, and didn't want to work with me, and so I instead of being confrontational, because I could have been, I kind of went to the supervisor with the issue, both of us. I pulled her in. Okay, let's just try to figure this out in front of the director. Sometimes you need to do that. Okay, sometimes there are circumstances that require that in order, because guess what? I told you this is a team-based approach. Healthcare is a team-based, and guess what? We were both surgical technicians, so we had to work in the surgery suite together. So whatever the differences were, we've had to get past those, because guess what? Patients come first. Not your little arguments, not your little he say, she say, I don't like this. No, the patients come first. Yeah. And so in order not to have a scene in front of patients, we had to do that. So there are times, thank you, Ahmed, that's a very good point. You have to bring in a supervisor or director, somebody that can, not be biased, not take one side, okay, but somebody that can really direct you in the problem area and kind of bring a resolve to it. Okay, so that's a very good point. Anybody else do anything else? What else can be done?
You and a coworker can sit down and talk about it.
Yeah, if you can. And they're willing to.
Yeah.
That's a good approach. Definitely try to approach that first. you know, but if the confrontation is too much, it's, you know, word
And
throwing and,
then
you
go
know,
to somebody
then
else.
you got it.
Then
You've
go to
got
the
to,
supervisor.
got to. Very good. Anybody else? What do you do when those times come?
Just try your best to keep a positive attitude.
Okay.
Sometimes I try to use humor to diffuse a situation. I try to like joke or laugh or say something humorous, and then a person like, okay, this person is non-threatening or not as like mean as I thought they were, or something like that.
Aggressive. Yep.
Yeah. So, or sometimes you just smile. It could be you, and you don't know that it's you that's putting off that negative vibe. So sometimes you just have to smile and just roll with the punches.
I like that. I like that. Very good. Very good. All right. So here's the. Can everybody see that? So the toothbrush says to the toilet paper. Toothbrush says, sometimes I feel that I have the worst job in the world. Toilet paper say, yeah, right. I don't need to explain that to anybody, do I?
No, hope not.
Oh, okay. All right. Because they both doing jobs that are hard. Okay. So just because you think you're having the worst or you have the worst situation, there's always somebody else that's got a worse situation than you. Okay. You're not the only one in that situation. All right. So you got to think like that. Okay. And you got to keep your motivation. Okay. You know, what is the drive for your interest in your career? What's the passion behind it? You know, what motivates you to want to do that? What motivates you to want to be a dental assistant? What's the motivation? What's the passion behind I want to be a phlebotomist? What is, you know, you've got to find that motivation because, you know, guess what? This week is going to be a good week and everybody's going to be behind you, wishing you well with your career choices. But what happens when this week is over or the next 2 weeks, as somebody corrected me before, 2 weeks, right? What are you going to do then? Who's going to motivate you then? Who's going to push you then? So you have to find your own motivation. What's that drive, that thing that's going to consistently push you to want to keep going in your career path? Okay. You've got to find that motivation, whatever that thing is. Some people get into healthcare because they have sick family members or somebody in their family that they're taking care of. So that's pushing them now to get into the healthcare position so they can now help, you know, on both ends, help themselves, help the family member, you know, become something in that career. That's their motivation. Okay. So you have to now know what's your motivation? What's that thing? What's that drive? You know, why do you want to become what you're thinking about? You have to have some type of a passion or motivation or drive, something that's driving you to become that way. Okay, everybody understand that? Yep.
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 What I noticed helped with a little motivation now is having a vision board.
Yep.
Before, like I didn't really believe in the whole vision board things, but then like actually having a vision board and seeing it every day, I'm like, okay, this is my goal, this is what I want, this is what I want to do. That actually helps with motivation and stuff.
That's it. However you got to motivate yourself, you got to do that. Some people have sticky points on their mirror every day they get up. You got to look at yourself in the mirror, so you're going to see your sticky points on the mirror. All right. Some people, you know, it may be a picture of something,
a song.
It may be a song. Okay. But whatever that motivation and drive is, that's going to push you even beyond these next 2 weeks. You've got to find what it is, that passion that makes you want to do what you're getting into. Okay. Because it makes no sense trying to, you know, have a little passion and motivation now than when you got to do the schooling, when you've got to do the homework, when you've got to turn in test papers. It's like, oh Lord, I didn't sign up for all of this. You know, but no, you've got to keep, even in those times, you've got to still push yourself, still keep that fire, that drive. Okay, find that thing, whatever it is, you've got to find that to keep going. Okay, let that thing motivate you and push you and get you to where you need to be. All right, everybody understand that?
Yes.
Yep, very good. Okay. um, Applying Whoops. Work readiness skills to careers. So why would a person need honesty and integrity in finance, in healthcare? Why?
They're not stealing.
Yeah.
Hello.
You want to be able to trust them with your money, with your confidential information, with stuff like that.
All right. So honesty and integrity is important. Why would a person need teamwork and team-based care in a hospital? Why?
Because you can't do it all yourself. You can't drive the ambulance. You can't revive the patient. You can't sterilize the instruments. You can't do everything yourself. So there's like an assembly line. There's a process to everything to get the car correct.
Very good. All right. Following rules and regulations in X-ray. Why? Why do I need to follow rules and regs in X-ray? Anybody?
Tell somebody results and be wrong.
Because what?
I had an X-ray done once, and I asked them, "Oh, so does everything look okay?" They're like, "Well, we can't tell you that. The doctor's got to tell you that." And I didn't understand. I'm like, "Well, you're the one doing the photo. You know what you're looking at." And they said, "Well, that's against the rules. I can't, misdiagnose or tell you the wrong thing. I could be wrong." So they were following the rules.
Exactly, and they're absolutely right. You're not in that position to diagnose somebody. And even if you know a diagnosis, it's not for you to say. You know what I mean? Even, I've worked in the emergency room. Sometimes I have to go to the ICU unit, and people were coding and passing away, and I'm coming out of the ICU unit, and the family members would jump on me right away. Is that such and such okay? Is such and such okay? Now I know that they have just passed,
Right.
but I can't. It's not in my job description. Number one, I'm not qualified to tell you that, even if I know.
Right.
It's not my position and it's not my job, and you remember that. Okay, I'm not the doctor, I'm not the surgeon, I don't pronounce anybody. I didn't go to school for 4 or 5 years, 6 years. So even though I know the situation, I have to follow the rules and the regulations of the position and the job, because guess what? I can get in trouble for saying something.
Right.
Okay, you can get in trouble for that. You can get fired for that. Trust me, I've seen it. Okay, so you got to following rules and regulations is key. And so they were right, Cassandra, not to tell you, they were right.
Right.
All right. Good writing skills. Why would a pharmacy tech need good writing skills? Why? Because what?
Because people need to read your
Make sure- so they know they have the right dosage.
Yeah. You ever seen how the doctors write?
Yeah.
Horrible.
Chicken scratch. You ever seen that? You got to be able to decipher what in the world. And sometimes you got to call if you don't realize, you don't recognize 4 looks like, or the 6 looks like an 8, the 8 looks like a 6. Make sure you make those phone calls, because one simple mistake can mess everything up. One mistake can get somebody killed. It can get somebody injured. Okay, and I'm telling you what I know. All right, punctuality, good attendance. Why is that in surgery? Why would you need good attendance and punctuality? Because
somebody's on the line.
What was that?
Somebody's life is on the line. There's a timely manner. It's not like they can wait for you to waltz in and they have like somebody's chest open up on the table and they need like certain equipment and stuff. Like they can't wait, like your phone go off. They're not waiting for you to answer your phone and stuff.
Right.
Anesthesia might run out. I mean,
hello. Or if the blood pressure drops.
Right.
Right.
Surgery schedules get backed up.
Huh?
Yep.
Yeah.
You don't want surgery schedules to get backed up.
Exactly. So being on time, being punctual, being where you're supposed to be at is crucial to a person's survival. Okay. And it's not just in surgery. Okay. Even if you're getting blood drawn, and you have to get that blood drawn, because some blood is time based. Okay. Some levels and medications have to be drawn at a certain time, you know, and if you miss those, you all have children, right? So women, you know the glucose tolerance tests that you had to
Yeah.
take. You know that nasty stuff that you have to drink.
Yes.
Remember
Oh
that?
gosh. Yes.
All right. And so every time on the hour, half hour, they have to draw blood to check on those levels. Okay. Or there's a test called a bleeding time. I don't know if anybody ever had that done, but you know, they have to check certain levels. And if the phlebotomist is not around on that half an hour and they miss that, then it screws everything up. Then you got to come
start
back
all
and you got to
over.
start it all over again. And I've seen some real upset women. Pregnant too. Okay. So punctuality is key. Common sense as a transporter. Give me an example. Common sense.
Traffic, you might want to use a different route. You know, if you know a certain area is congested and that patient needs to get there on a certain time, maybe just choose a different route. Common sense.
Okay. What about inside the hospital or facility?
I guess transport people with care, even though it might be like an urgent situation. You still gotta be careful.
Yes. In the hospital.
Or triaging, prioritizing.
I hear a lot of noise for some reason. I don't know. Okay. In the hospital, when I used to work at the hospital, they used to have 2 elevators, right? One was a service elevator and one was a regular elevator. And so part of my job as a transporter was to transport the living and somebody say it, the living and the
Dead.
dead.
Deceased.
Yes. And so there are times where the elevator, I'm not supposed to take the deceased on the regular elevator. They go on the service elevator. So sometimes you would have people riding the service elevator and not using the regular elevator. So I had to change routes, you know. I've had to get the patient back behind a wall so people can't see what I'm doing because they're on my elevator. Okay. I have to wait until that happens. Okay. So sometimes you got to go different routes. Okay. To avoid certain things. Okay. All right. So something like that. Just something as simple as using common sense. You don't want to freak nobody out. And then since I'm here, I did not know that was part of my job description. Okay. Because I was so happy to get the transporter job that I didn't read everything about the transporter job. All right. You know, sometimes we get happy and we don't read the policies and procedure manual. Right. We're so happy to get the position that we don't. And so we miss certain things. That's why I tell people when you get a position, make sure that you read, you know, everything in its entirety so you know what's expected of you. And when I got that job in '91, I did not read. And so part of my job was to actually transport patients to the morgue. And I didn't know that. Okay. Until the first time they told me, said, John, can you help us take this patient to the morgue? Where? Okay. I was freaking out, you know, so like, okay, I have to take them by myself or are you coming with me, you know? And so, you know, I did not know, so I didn't read. And so I was kind of, you know, surprised the first time. But after that, you know, it's part of my job. It's in there. If I had taken the time to read the manual and the policies and procedures, what's expected of me in that position, I didn't do that. And so I was surprised the first time, but I knew that was an expectation that they would need a transporter. Somebody needs to go to the morgue, okay? So make sure you read that. You read the policies and procedure manual of any position or career so that you know. All right, let's keep moving. Good personal and professional appearance. Why is that necessary in nursing? Because of what?
So people respect you. That's the first thing they look at is how you dress and how you look.
Yep. Okay.
And also, you don't want to be sitting there as a patient and a nurse comes with somebody else's blood in their shirt. You'll feel a certain type of way. Like, I think that might scare me.
Yep.
Yep, that's like personal hygiene.
Yep.
Yeah, hygiene, yeah.
Anybody else?
You will want to be able to distinguish the people who work there from people who just walk in off the street.
Exactly.
And just sometimes you hear color.
Well, I don't know how it is nowadays, but you know, back in those days, you know, you couldn't do certain things,
I
especially
know.
when it comes to your appearance and things like that. Your nails had to be a certain length. You know,
Certain you can't wear jewelry
right?
at certain jobs.
And I tell you, when I was working as a surgical technician, you cannot put on strong deodorant in the surgery suite because
Okay.
smell would knock off some of the optics of the laser smell.
Okay.
Yeah. You know, so those strong deodorant and things like that, we couldn't on surgery days. It's not permitted,
Yeah,
and they would
wear.
tell you that in the policy and procedure manual. You know, it was actually written there. Okay, so good professional and personal hygiene is definitely needed from somebody that's working in the nursing field. What about staying on the job until it's finished? What about that?
I mean, maybe we don't want to, but yes, you have to because you can't just leave somebody there. You can't be like, okay, my person who's coming from me will be here in about 10 minutes. I'm going home, and then that person never shows up, and then something happens to the patient.
Exactly the point. You don't want that on you on your shift because there used to be a turnover shift sometimes.
Yeah.
And then and then you're looking for a report from the nurse or the LPN, and they're gone. You know, so now you got to go around, scramble, get your, find out what's going on with the patients, who's there, notes, no notes, so we've got to make sure that we stay on this position until it's finished. Don't have somebody, can you punch me out early? I gotta go pick up Johnny. Make sure you stay on that job until it's finished. Okay. Ability to read and follow instructions in sterile processing. Why is that important?
Some things need to process longer than others. I mean, to really make sure that it's being cleaned.
Hello. Okay. I used to work autoclave. So you put the instruments in the autoclaves. You cannot take out the instruments before time. Okay, because hasn't completed the cycle, as Cassandra just said. Some things need to be left. Okay, until it completes the cycle. So follow the instructions. Nothing worse than pulling out instruments and they're not clean, and you need them for surgery right now. Okay, it could be a disaster. And the last one, strong communication skills as a med tech. Why is that important?
Just want to make sure that you don't give more medication or less medication than necessary.
Who's saying that? I can't see Faith. Okay. Oh, there you are. All right. Simple. You want to make sure you're giving the right amount of medication. Okay. That's why you got communication is key. Finding out what is the correct dosage, speaking with the persons involved with that patient. Okay. Because the worst thing you could do is get the wrong medication. Okay. The wrong measurement. That's somebody's life you're talking about. Okay. So we got to be careful. All these things may not matter to everybody, but it matters to somebody. Okay. You're going to have to face some of this stuff. All right. Very good. All right. So what does it take? Research your health career goals. What does it take? What skills do I need to achieve my goals? You got to ask yourself certain questions. You're getting into these careers. You got to know what skills you need, what training and education is required, and then do you have or will you have the resources to acquire the special skills needed? One thing you can say, yes, because the workplace is definitely a channel to get you the education and skills you need. Okay. So, and then ask yourself other questions. If you got to go back to school, how long will it take you? How long do you have? Okay, what is your time frame to reach this goal? How much time do you really have to commit to that career path? Okay, all these things, these are questions that you need to ask yourself. What is the salary? What is the starting salary? Getting your foot in the door, what are they starting you off at? Okay, is that enough money for you right now? Is that going to work for your lifestyle? Okay, all these things are relative. Okay, so you've got to do your research on these career goals. Okay, and then another big question is, after researching that health career goal, do you still want to pursue it? Or do you want to explore other careers in healthcare? Okay, these are questions that you need to ask. All right, career exploration and research helps. Okay, you have state support agencies, unemployment services, network with friends, families, strangers, free social networks. Okay, a lot of people use Indeed.com, Monster, those types of jobs, looking for jobs, looking for positions. You know, use the free things that are available, accessible to you. Free email accounts. Make sure that you have a professional email account. Okay, not the personal ones. If it's professional, then use the professional ones. Because trust me, I've seen some email accounts, and they are not professional. SassyMama.com does not work everywhere. Doesn't work everywhere. Okay, it doesn't work everywhere. That might work some places, but don't put that on your resume. Okay, I've seen all kinds of stuff. All right, make sure you have a professional working email, that when employers look at your resume, they are not shocked. Because guess what? Your resume is going into file 13. And you know what file 13 is?
Trash bin.
There you go. All right. They're not going to have time to, sassymama.com. No. All right. Use unemployment resources. Connecticut Works, the workplace, obviously, where you are. Career resources, platform to employment, youth works, all these are research and helps that can help further your career. Okay, and then let's look at this. Soft skills employers are looking for. Okay, employers are looking for somebody that's completed basic adult education. Okay, basic programs, diploma, credits, degrees. Somebody that can read. You have good reading skills, planning skills, writing skills, organization skills. A lot of people say I have people skills. I like to say this part, socially perceptive, okay? You understand people, and you understand, you don't have a problem with diversity or mixing with cultures, okay? Everybody doesn't look like you that works at the hospital. You're going to have to deal with people from every different walks of life, different cultures, different backgrounds, different beliefs, okay? So you have to be perceptive about that in this social world that we live in, okay? Math skills. I can hear some noise. I don't know where that's coming from, but okay, make sure your phone's unmuted. Math skills, typing skills, decision-making skills, communication skills, directing skills, okay? All these things are experiences that help you succeed, okay? Here's some more. And these are some strengths that if you have them, then you need to get this, write this stuff down. Critical thinking, self-awareness, okay? You have self-confidence, assertive. You have goal setting and planning skills, okay? You know how to put a team together, to work together as a team, to a collaborative effort. Problem solving, in a professional environment and in a personal environment, okay? These are things that employers are looking for as well, okay? So, question, why are some people more contented and more positive than others when they have what going for them? And you're not going to look at my list. Why are some people more happier in the workplace and contented when they have what going on?
when they're happy at home, when they
Who's
when
that?
they feel
Was that Ahmed?
yeah, when they're happy at home, when they feel like they don't have any outside stressors, they don't have any stress to bring to work.
Okay, I like that. Anybody else?
When they have a good perspective on life, where they're going, you know, they can see the end goal.
Okay, when you can see the end goal. Yes. Anybody else?
On Friday, when it's payday.
That's when everybody gets happy, right?
That's when everyone's happy.
Okay, anybody else?
I think sometimes when you have good family support,
Yes.
and it's not too much negativity.
When you have a strong family support. Because guess what? If you have small children, when you start do training and things like that, now before the coronavirus, you would have to go into school and go into, you know, Housatonic, different places. Yeah. But now, because you got coronavirus, you know, around, you probably don't have to go into those places, or some places may be opening back up. Some schools, I don't know how it is up in Connecticut right now, but you know, I know some places are slowly transitioning back. So you're going to need a support system in place, a family member, a cousin, mom, whoever, to try to help you out with the child care situations, things like that. Okay, so strong family support is a good one. Anybody else?
Positive attitude.
Positive attitude, that always works.
Knowing your job, you always feel good when you know what you're doing, like knowing your job. Being a professional.
Being professional, knowing your job. Very good. Okay. Anybody else? That's it.
Depends on what's going on in your life overall.
Say it again.
What's going on in your life overall, how it makes you feel.
Yeah. Depends what you got going on. Yep, I like that. Rondé, you still with us? What you got your music? What you listening to?
Oh no, I'm listening to you guys. I told you I fell.
I know.
I'm sorry, the pharmacy. I'm sorry.
You fell? Oh no.
No, that's what I told you when I signed in. I had to get the X-ray.
I thought you said you fell.
I sent you a message.
You did?
Yeah, I sent you a private message. Hi, 1 second. I'm sorry. I'm sorry.
All right. No, go ahead. Do what you got to do. Go ahead.
I'm trying to mute it.
Oh, okay. Picking up medication. I understand. All right. Let's just keep moving. Listen, we're doing real good. We're almost there. I'll tell you why. Research studies have shown characteristics of people who are positive with their lives. They have strong family connections. I think Shantae said that. Shanique said that. Yep. They contribute to the lives of others. Okay. They take control over their own life. They have leisure time, activities. They have a religious or spiritual life. And then others include outside things like music, pets, exercise, eating, and yes, sex. All of that is inclusive. Why some people are more happier and more positive than others. Believe it or not, it's the truth. All right. So let's look at this real quick. Success principles. Okay. In order for a person to become successful in their careers, these are some principles taken from the author Napoleon Hill. He wrote so many books on positivity and a positive attitude, but these are taken from his book. A positive attitude is a principle, definitive purpose, knowing what you're here for, going the extra mile. What about that? Going the extra mile on the job. Some people don't want to do no extra. You ever know people like that don't want to do nothing else extra? Yeah. That's not my job. That's not in my job description. Some people are like that. They don't want to go the extra mile. But listen, healthcare is wide open. Some patients require you going the extra mile. Sometimes you're going to have to stay the half an hour after to help that patient. Okay? And it's a principle, because guess what? Patients never forget what you do for them. Do you all ever forget the nurses and doctors that helped you deliver your children? You don't forget
Well,
them, do you? Well, for
the
the
nurse, the nurse who helped deliver my son, she had a nasty attitude.
unless you get Nurse Ratchet, then that's different.
Yeah, but that's why I won't forget her though.
You still won't
That's-
forget her, yeah. Exactly.
Yeah.
It makes an impression on you, whether it's a good one or a bad one. Unfortunately, a lot of people have bad impressions. You know, unfortunately, the bad ones we remember. And then
Yeah.
you tell all your friends, listen, don't go to that hospital because,
Yeah.
you know, and so the hospital gets the bad reputation now based on that one patient, or I'm
Yep.
sorry, nurse.
Yeah.
It could be one doctor, one transporter, one med tech, one surgical processor, one dental assistant, okay? Gives that whole company, organization, a bad name, all right? Accurate thinking, self-discipline. Can they trust you when they leave you on the job to get the job done? Okay, do you have any discipline there? Okay, I like number 8. Number 8 says a pleasing personality. What is your personality like? Okay, you got. Let's just do a personality check. If we ask your friends, your family, what's their personality like? Because the employer needs to know, right? If you go for an interview, all they want to know is how are you going to fit into the system that we have working here? Okay, your personality could mess it all up based on how you interview for that position. Okay, it starts from there. Okay, that's why you go into these interviews and things like that with a positive mindset, positive outlook. Okay, let them know you need me to fit into what you have going on. As a matter of fact, if you don't hire me, you're losing out on me. You're missing something because I'm going to make whatever you have in place work better with me being there. All right, that's being confident right there. Okay, so all these are principles. Teamwork is there. Creative vision, those people that have creativity about them, because some jobs you're going to have to find a creative way of getting it done. Okay, you got 5 patients, 6 patients, you're going to have to think of creative ways how to address each one of their needs in a timely fashion. What's first? Who's first? How are you going to organize your time? How much time are you going to spend on this patient? How much time are you going to devote to this? To write your notes, to pass out medication, all right? To get the instruments ready for the surgery, okay? To do the x-ray on the teeth. What if the child doesn't want to cooperate with you at all? Okay? So all these things you've got to look at and think about them as principles, okay? Look at them. And then we're rounding this off because I'm just, again, giving you the condensed version. We call these smarten up goals, all right? Smarten up goals. Goals have to be specific, measurable, attainable, relevant, time-bound, enthusiastic, natural, understood, and prepared, okay? And like I said before, I can send you the PowerPoint. How many people want this PowerPoint? I can send it to you all. Do you all
I want it.
You don't
I
want
do.
it?
I've been screenshotting the PowerPoints.
No, don't do that. I'll email it to you.
Okay, then. All right, that'll work.
I can email it to you.
All right.
So who wants it? Let me just see again so I'll make sure I don't. Yep. Kendra, hello. Kendra? Oh, you there? Okay.
Did you see my thumb?
I saw one thumb. That's all.
Printed out already.
Huh?
I have all the power slides, like the PowerPoints printed out.
Oh, wow. Look at that. You show off. I'm just kidding. I can send it, make sure everybody has it. I'll send it to you by email, those that really want it. Because it's going to make a difference, all right? Specific goals, okay? If something is specific, that's why I asked you in the beginning, what are you specifically thinking about as far as career? Because you have to be specific when you're talking about making a career goal, okay? Somebody jumped off and they're jumping back in here, all right? Specific goals, okay? You have to know who's involved in your goal, okay? Of course, the workplace plays a big part in you achieving your goal. Who else is involved in you achieving your goal? You got to look at the immediate surroundings, okay? If your family members are, mom, you know, whoever's helping you out with childcare, you know, everybody's included in you getting to your career goal. What do you want to accomplish? Okay, as far as your career goal. These things you have to be specific about. So this is going to kind of try to help you, Ahmed, you know, when you're thinking about, you know, think about these things. Ask yourself these questions, all right? Where, okay, that's why I asked you where, identify a location. When, establish a time frame. Every goal has a time frame. The disciplines that you're thinking about getting into, they have a time frame. How long is the course? How long is the dental assistant? How long is the CNA? How long is the phlebotomy? Okay, these are things that you have to know when you're doing your research. Okay, of course, the career counselor is going to talk to you and tell you the best possible answer to those things, but you have to do your own research as well. Okay, make sure you know. Make sure that you have that time to commit to that. If it's 6 weeks, if it's 4 weeks, if it's 3 months, okay, you have to know the time frame. It's important. Okay, identify requirements and constraints. Okay, what can hinder you? Or what can stop you from getting to your goal? You have to know that also. Okay. Specific reasons and purposes or benefits of accomplishing the goal. That's why I asked you why. What is it about the dental assistant? What is it about the phlebotomy? What is it about the CNA that you want to get into? Okay, you have to know the purposes and the benefits of accomplishing that goal. So goals have to be specific. They also have to be measurable. Okay. In other words, how much, how many? How will you know when this is accomplished? Okay. How will you know when you get to the goal? Okay. Yeah. Goals have to be measurable. They also have to be attainable. Okay. And the skills that make goals attainable, you have to develop the right attitude, the abilities and the skills and the financial capacity. Okay. Of course, the workplace is helping you with the financial piece. Okay. So you really don't have to stress on that because the workplace has already mapped out a certain amount to everybody in the program. Okay. As long as you finish the program, you are welcome to get that financial help from the workplace. Okay, so you don't have to develop that. It's already developed for you. Okay, which is a good thing. Okay, so goals have to be attainable. They also have to be realistic. Okay, it has to be something that you can work towards, an objective. Okay, you have to be willing and able to work towards it to accomplish it. Okay, so goals have to be very realistic. Okay, it represents the vision for your life. This is what I want to do. This is what I want to get into. This is who I am. Okay, be realistic with yourself and with the goal. Goals also have to be timely, within a time frame. Okay, I told you how long. How long is it going to take you to get to the end of your career goal? Okay, it's just like us. Let's just be realistic. If we want to lose 10 pounds, 15 pounds, what are the factors involved in that? How many times a week do we have to work out? For how long? What are we going to change in our diet? What are we going to increase with the water? You know, everything is time. And then how long is it going to take you to do that between June and, okay? So goals have to be within a time frame. You have to map out a time frame to get that goal accomplished. All right. Then enthusiastic. Okay. I think Cassandra mentioned that earlier. You know, you got to be enthusiastic about this goal. You know, if you're not enthusiastic about it, how do you expect us to be? if you're not happy, if you're not enthusiastic about it. Okay. When you're talking about your goal, you should be excited. Yes, I want to do this. This is something but if if I'm not feeling your enthusiasm, then why should I be enthusiastic about it if you're not? Right? You've got to find that enthusiasm. Okay? You've got to make sure that this is what you want to do. Yes, I want to do this. I want to be the dental assistant. I want to get involved in that. This is something I've always wanted to do. Okay, you've got to find that enthusiasm, whatever it is. You've got to find it. Okay, then goals have to be natural. Okay, instincts, self-awareness, intuition. Is this goal really for you, or this is a goal that somebody thinks you should have? Okay, ask yourself that question. Is this goal really for you, or did somebody else, because it looks good, or it's in your family, or, you know, but is it really for you? So you got to do a self-check to make sure that this goal that is natural, check your needs, your values, your beliefs, okay, and see what changes you can make to make that goal fully yours. Yes, I want this goal. This is my goal, okay? Then, I talked about this earlier, goals have to be understood, okay, by people that's involved in your goal. That's why I asked you who else is going to be involved in you getting on your career path to your goal. Okay, yes, maybe a significant other, maybe a partner, maybe a friend. Even your kids have to understand, okay, that you are working towards a goal. So there's going to be some changes here, okay? Now, this doesn't mean you have to tell everybody what's going on with you. Everybody doesn't need to know, right? But to make sure that you tell the right people, the key people that's going to help you get you to accomplish your goal, okay? So goals have to be understood. They have to be, you have to be prepared also, okay? Even if you're prepared, there may be still some people giving you negative comments, negative reactions from people, okay? Just because you're moving ahead with your goal and they're not. Okay, so be prepared, you know, for setbacks, okay? People may say, you know, comments or, you know, not really support you all the way because you are making progress and they are not. So we have to be careful of that. Be prepared for that, okay? You have to invest in yourself, okay? People are not as invested in you as you should be, okay? You've got to invest in yourself. So you have to be prepared. So, Mr. John, what's the point? Well, I'm glad you asked. Developing, maintaining, and improving your career goals and your mindset requires diligence, commitment, stability, focusing, competence, ability, and perseverance. All right? We got about 10 minutes left. Any questions so far? Any questions on anything? Everybody still with me?
With you.
Let me get back. Make sure I can see everybody.
Yeah, we're here. We're here.
Nobody falling asleep? Shanique, look like you haven't moved from that spot, like you're lying on the bed, relaxing. Ronane, you all right? You good now? Yeah?
Yeah, I'm good.
Okay.
I said Renee's on the move.
Renee's home now.
From the car to the office.
My service is horrible in the house, so I'm like back on the porch.
Okay. All right. Very good. Does anybody have any questions about anything I just talked about? Any questions?
I believe this might be my last class because I've done a bunch of these classes pre-corona, pre-quarantine. I just missed like 2. I believe this might be my last class, but if I want to like touch bases on you with certain things, I can just like email you and stuff like that.
Yeah. I think you have to be here tomorrow.
I'm not. I'll find out.
Because you haven't done this class with me before.
Okay, because did you do it in Bridgeport? Did you do because I've done classes in Bridgeport with other people hosting classes and stuff like that. I've been to at least like 6 or 7 different classes and I missed just 2.
By the workplace?
Yeah.
I'd have to check with Adrian on that one.
Okay, yeah, I believe this is my last one because I've done a bunch already, but not online. I've done them actual in the classroom in Bridgeport, but then I'm just like I said, I missed 2.
Okay,
so
have you done the workplace? Have you done classes with the workplace before?
Yes, the orientations. I've done these programs with people coming and talking to us about
our chart our test that we took, assessment test. We talked about
DISC assessment. Yeah.
We talked about how to talk in the workplace, how to be professional. We pretty much like 6 different classes I went to in Bridgeport.
He attended.
I just missed like my first one or 2. That's why I think I'm making it up.
Hold on.
Okay.
Adrian, what was that?
He attended in February and he missed 2 days. But when I went back and looked, he should have been in tomorrow's workshop. So I'm at, if you just participate tomorrow, you'll be done.
Okay, not a problem.
So come back, John, send him the information tomorrow as well.
Yeah.
And he'll be spending tomorrow with you for the navigating workshop, which is the important one as well. And then you're done, Ahmed.
Okay, no problem.
I'll let Jane know.
Okay.
Right.
But you're good.
Oh, I was about to take that personal, man, like you do.
Oh, no.
I'm just kidding.
Has nothing to do with you.
I'm just kidding. Yeah, so just tomorrow's workshop, again, is going to be navigating your career path. So we're speaking some more about your career, okay?
Definitely.
And so hopefully, you know, you'll get more of a broader understanding about which particular career path, you know, you want to start venturing down, because there's so many, all right? So yes, come back tomorrow. I'll send everybody, again, the Zoom link. I'll make sure I email that to you. Does anybody have paperwork for tomorrow's class? Navigating your health career pathway. Nobody was sent paperwork, right? Nobody was sent paperwork. Okay.
I think I have that hard copy from when I went to the class. I have to look at my folder.
Okay.
Yeah.
All right, because I know.
No, you need to send it.
Oh, okay. Thanks, Adrian. Then I will send. I'll send everybody to make sure you look out for the Zoom link. I'll also attach or send a different email with this PowerPoint on there. Is there anybody? And for that, does anybody have any other questions?
What time tomorrow? Will it be the same time?
Same time.
Okay.
Same 9 to 12.
Same bat channel, same time.
Same bat channel.
Oh, it's the same login, right? It's the same login for Zoom?
I'm going to send it to you. I'll send the Zoom link to you.
Okay.
Yeah. I'll send a, it may be a different Zoom link, but I'll send it to you tomorrow, this afternoon.
Okay.
Okay. I'll make sure everybody has it. Any other questions?
No.
Comments?
No
concerned? What was that?
Is there any homework? I'm sorry, I have to be that.
I'm going to ask you tomorrow morning what you got out of today. So be prepared to answer that. Okay. I will send you the PowerPoint so you can look it over and see if there's anything on there that you want to talk about or, you know, you found interesting to yourself. Okay. But listen, I thank you all for being on this morning. It's a pleasure to meet everybody. I'm excited for you guys starting your career path. So I just want to thank you for your participation, for hanging out with me. I hope it wasn't too boring for you. Don't answer that.
Not at all. You're good.
No, it wasn't boring.
No. Good. Very good. Very good. Because I try to get everybody participating in everything. Okay. So come back tomorrow morning, same time, 9 o'clock. I will make sure I send you the information so you have it. All right. And have a great afternoon.
You too. Everyone have a good day.
Bye. Thank you.
Bye,
everyone.
guys.
Tomorrow.
Thanks, Adrian.
You're welcome. Bye-bye.
Bye.